Mothers in Medicine Fund is a collaboration with the Sharp Index, a nonprofit dedicated to reducing physician burnout. The Mothers in Medicine Fund provides grants to women working in clinical fields to help them pay for childcare. Today, we're speaking with Dr. Efrat Bruck about the challenges and financial reality of starting a family and raising children during medical school and residency. Efrat is an incoming anesthesiology resident at the Mount Sinai Hospital in New York and founder of MD Inspire, a consultancy that supports individuals looking to improve their pre-med and medical school applications.
Hi, my name is Dr. Efrat Bruck. I just graduated from the Icahn School of Medicine at Mount Sinai in New York City, and I'm staying here for my anesthesiology residency, which I'll be starting in July. So my background before medical school is actually in education. I was a high school teacher for close to a decade before medical school, and then I spent 1 year as a content specialist for Khan Academy, where I created MCAT videos, which you can find on YouTube and the Khan Academy website. I'm originally from Brooklyn, New York. I have 9 siblings. My father is a rabbi and a teacher, well known in the Jewish community of Brooklyn. And I had 2 children during medical school. My older one is 4 and my younger one is 2.
So Efrat, first of all, I did Google you and I did find your videos on Academy, so that's awesome. But so when we were talking earlier, I was blown away by the idea of having children in medical school and how busy things were and the financial burden of that. So can you talk a little bit about that? And I ask you to be elaborate, because I think a lot of people in our industry don't realize the financial burden of medical school, the number of hours you put in to get your degree, and how crazy it is to have children during that time.
Yeah, so I'm really glad you asked this question, because I do get this a lot of the time where people, say things like, oh, well, doctors are like such high earners, and they don't really understand that not for a very, very, very long time. So to become a doctor, you need, 4 years of, at least 4 years of college. And then because medical school is so competitive, many people even take an extra year or two to do various things to become more competitive applicants. And then you have 4 years of medical school itself, during which you're a full-time student and you're not earning an income. So just to give people a sense of, the cost of medical school, I went to Mount Sinai, which is a private school, and tuition was around the $60,000 a year range. Some private schools are $80,000 a year. So if you multiply that by 4 years, that's above $300,000 just to fund your medical school education. State schools are a little bit less, but still, between $30,000 and $40,000. So there's the cost of medical school, but then there's also the opportunity cost of you not working for those 4 years and having to fund your living expenses, right? You have to live somewhere, you have to buy food, but it doesn't end there. So after that, if you want to practice independently in the US, you have to do a residency, which is a time where you're like what I'll be doing these next 4 years. So you're a physician and you operate fully like a physician, but you just can't work alone. You have more experienced physicians supervising your work. They're called attending physicians. So sometimes that means you're doing everything and they just sign a paper, or sometimes it means that they're kind of coaching you along. But that's a job that does not pay a lot. Like I'll be making, relatively, I'll be making $70,000 this coming year, which if you break it down per hour, where I'll be working anywhere between 60 and 80 hours a week, you're talking about like something, very, very low wages. And that's for, it goes up a little bit every year, but your residency, essentially you're making about that amount of money for another 4 years. So it's not until you graduate your residency and possibly a fellowship, which is another year of training, that you're actually earning those doctor salaries that you can Google, that people are talking about when they say doctors are high income earners. And again, during residency, the opportunity cost of not having, a job that's, funding you enough to live. So that's the realities of medical school.
Yeah, it's intense. and then add on to that the cost of having a family during this time, right? And
exactly.
over at the fund, we've done averages, right, nationwide, and some parts of the country it is cheaper, but overall, and I know in your region it is exceptionally much higher than our average. But we say, oh, it's about $1,000 a month per child. That is a lot of money.
So I will tell you that in our case, it's a little more than $1,000 a month per child. And there were times that it was even more, depending on, when they're younger, it's a little bit more expensive because of the ratio of, teachers to students. But childcare where I am is extremely, extremely expensive. I know my husband and I didn't quite understand the implications of, the cost when we moved here. I wonder if it would have affected our decision differently. I mean, we're happy here and everything, but we definitely did not fully understand what it means to raise a family in New York City, what the financial implications of that is. Yeah.
Absolutely. Absolutely. And, we also talk about, gender disparity once you get into actual clinical practice, right? And how what are ways that we can help, and how can society support women in this way, right? And I think it's just, this is why I appreciate you talking to us about this, because I think that the true financial and personal impact of having a family is crazy for a woman in a professional field, especially in a clinical field. So do you have, how do your peers get through this, right? Is it normal? Like, do you have a lot of peers that also have children during this time, or do people delay?
So this is like location and school dependent. Where I am, not really. Like, I think in every class there are maybe an average of 2 or 3 people with children. Every class is about 140 students. So not a lot of us. I know that there are schools that have, Einstein, for example, I think something like 10% of the student body has children. So it's going to vary based on location and the type of demographic going to the school. Right. And also the age, people at Sinai, the average age at Sinai is a little bit lower than the rest of the country because of our FlexMed program, which would take a long time to explain. So I won't go into it right now, but it depends on that too, like what's the average age in your medical school. But this is a really, really important point, because clinical training is long. Well, for physicians is long. It's just the reality of it. No matter how, whichever way you do it, a little faster, a little slower, you started a little younger, a little later, it's just long. And it tends to coincide with women's most fertile years. And many women, we don't want to choose one over the other. And I don't think we should have to in this time of history. So I think it's a matter of giving women the tools to do it. As far as my peers, you have to have some sort of pragmatic setup that makes it work. So, most of us have a working spouse, that definitely helps. And then, if that doesn't cover the exorbitant expenses, which many times it doesn't for myself and my peers, you can borrow money, the same money that you're borrowing to fund your tuition, for example. You can also take out loans to help fund childcare, or other, childcare would fall under living expenses. The caveat to that is, of course, you have to pay it back with interest, most of it. So that's another, calculation to make. But that's how, so basically with, a partner's help, help from, loans. And then I have to say Sinai has also been pretty generous. There are different scholarships available. They're not as large percentage wise as the types of scholarships you can get for undergrad, but it still helps a lot. Right. And some people have family that helps. So
yeah, which is nice for sure. But yeah, I think that, to your point about, can we give women the tools? That's what the fund is about, right? Like how can we help women out? And I'm certainly not a clinician. I haven't had the experience you've had, but having reliable childcare early in my career, because like you're saying, you have kids like right as your career is just like taking off, right? And a lot of women choose not to keep going for a lot of reasons, and I understand that. But knowing that my children were safe and they were in an environment where they were treated with consistency and kindness made all the difference in my career. And I'm sad to look out and find out that there aren't that many programs available to women in that situation, because you're right. You shouldn't really have to choose, but we do, and we are, and that's unfortunate. Right. Yeah. So talk to me a little bit about how the grant helped you, because I was so excited when you reached out and you were willing to tell your story, because this is what it's all about. So how did it help you? What did it do for you?
Yeah. So, before even getting to the, practical aspect of the help, I was just stunned that someone out there, thought about this and like understood, our situation, because I feel like so many people don't. Someone took the time, that you guys took the time to put together this fund. So I have to say, just from an emotional, an emotional side, more than just not just the help. Like, I was sort of really happy for the next few days. Like, someone cares about us, someone understands how hard it is, and someone understands that with medicine, you can't really jump off the train. Like, it's too late. The cost is too high to be like, wait, it's too much. Like, you have to then get to that point where you're, a high earner and able to pay back those loans. Like, there's no turning back. Not that I want to, but, even if someone wants to, it's not always possible. So I really, really appreciated just the thought of it, and that someone took the time and the energy, and the means to put this together. So thank you for that. And then on the practical aspect, it's amazing because it's a significant lump of money. It covers, and right now for me, it covers definitely one child about one child per month for childcare. So that's really significant, whether it pays for now or whether it pays for my kids, summer program, because my daughter won't have school this coming summer, which I'm starting to worry about. It's a really significant amount of money. So it was so appreciated. Thank you.
That's awesome. Well, thank you for sharing your story. And just so everyone knows that the Mothers in Medicine Fund pays $1,000 flat grants. Again, that's kind of our average we assume this pays for maybe a month of childcare.
Yeah, so great question. So I think, the first step is, let's have conversations about this. Let's talk about the challenges. Let's let women know, what they're up against and what their options are. And then let's create tools to support them, whichever direction they want to go in, whether they want to have children, maybe they want to freeze their eggs, whatever it is, what are the options on the table and how can we give people the tools, for those things, and what are the implications, of making each decision, right? Because, from a medical perspective, yes, fertility declines a little, even starting in your 20s, but it's not very significant till you're around 35. So letting people know, what are the benchmarks, that you want to try to aim for if you want to have, a child or a few children, things like that. So speaking about it, giving people tools to support them, and letting people know what their options are. And then, as far as medicine goes, just because that's the area I'm most familiar with, I did something at Sinai that was extremely helpful. Sinai allowed me to take something called a decelerated year, which is you take 1 year of medical school, usually the hardest year, like third year, and you split it over 2 years. So it doesn't turn it into like part-time. I don't know that it's like law
I imagine
students
it's
who,
still
like, have a
pretty
job.
intense.
Yeah, it's still pretty full-time, but you can take breaks along the way, right? So if you think about one really hard year of your life, but you split it into two, so you do like a module and you take a break and a module and a break. And in my case, I was able to set it up such that when my second daughter was born, I was able to take off, I think it was over 10 weeks, maybe 2.5 months. So I had like a chunk of time to be with her. And then what gets really hard when you have children is the exams, the board exams, because your typical medical student just studies for 12 hours a day for a month or two and gets it out of the way. I don't know that as a mom of two, I could study 12 hours a day. It's just not going to happen.
Right.
So you need extra time for that. So I think this idea of a decelerated year, which, I know Sinai does, but I think other schools should adopt this model too, and, give, both women who want to have children this option, but also other people who have like obligations in medicine that just take time. I think it's a great model. And I think that other medical schools should adopt that.
That's awesome.
That's as far as, some practical tips for, how to do it if you're a parent in medical school.
Awesome. Well, what else? Any other last words before we shut off here?
Last words.
I shouldn't say it like that. Any parting wisdom for other women in the same place as you, or just, the industry in general?
I guess I would say that, if it's something you want to do, like if you want to pursue a serious career in medicine, whatever, angle you want to take, and you want to have children, it's possible. It's really hard, but people have done it and there are ways to do it. And I think, adding to what I said before, part of giving people the tools is to network and for people to have role models, for people to see, that other people did this, it's possible, and how did people do it? And not just how one person did it, but, here's how 10 different people, 10 different, methods and 10 different ways people set up their life to be able to do this. Because, I have my, the way we set up our childcare and our finances and everything. And I have friends who did totally different things and it worked beautifully too. And so there isn't one right way to do it. There are lots of different ways, to get to the top of that mountain, I guess. And you just have to find one that works for you.